Jacqueline, turn face Frank. All right, so I got her arm at 90-degree angle. It doesn't particularly matter. Scoot back just a little bit for me. All right, we're gonna start with digit number 2. Recenter where? PIP. So what I did, y'all, I just brought the tube over and centered it to the IR, and I got 40-inch SID. And remember, you're on wall bucket. Okay? So you shouldn't have to move this if you got everything from fingers all the way to elbow. This should stay. Okay? All right. So we're starting with second digit. We're centering at the PIP. All right, scoot back just a little bit towards this way. Come back this way. There we go. I'm just trying to keep everything in the same plane. All right, so we're at the PIP, which is here, right? And some physicians like for you to have an adjacent digit in there. So I got digit number 3 in there with it. Got all the way through the metacarpals. Frank, can you give me that container and get a marker out of there, please? If it's a left in there.
See rights.
Now, right?
Yeah.
Never mind, I got Jacqueline's. Thank you. Okay, so when you're doing extremity work, y'all, we want to mark the lateral side of the anatomy. Okay? All right, so I got a left marker. So that's PIP number 2. Move you over, ma'am. PIP number 3. PIP number 4. And PIP number 5. That works? Yes. All right. So Frank, in that container, I have a wedge in there. It might be under that. All right. So digit 2 when we do the oblique. So if you have this sponge in clinical, you can have the person put their fingers on each step, and you can do your obliques that way. You still center at PIP number 2, number 3. Or I'm sorry, not number 2. Number 3, number 4, number 5. Still centering at the PIP with your marker. Okay. Now, when we do the oblique number 2, remember we do a medial rotation. So I'm gonna roll you that way, okay? And we're centering still on the PIP. Okay, so remember 3, 4, and 5, we rotate laterally. Number 2, we rotate medially for the oblique. All right, and we're gonna try to keep your finger parallel to the IR. You may have some OID, because if I do this, I'm creating distortion and I'm closing my IP joints. So I want to keep my fingers parallel to the IR. Okay, that's digit number 2. All right, you can relax. Now when we do the laterals, let's just start with digit 5. You're going to close your fingers and we're going to point this one out. So we're still centering at PIP. Left marker there. Okay, so sometimes you may have to get your patient to hold these fingers out of the way. Or one more time, Frank, got my popsicle stick in there. So y'all are welcome to use that. You see it? Any one of them in that paper will be fine. Okay, that'll work too. All right. So sometimes you can get the patient, if they're like this, whatever, you can get them to just hold it out like this so it's perfectly lateral. Okay. So digit number 4, let's do this finger. That's the bad finger, right? Okay, so you can get them to hold these fingers back. And again, you want to keep it lateral. You don't want them to do that. That's hard. So Jacqueline, you're going to hold this and you're going to press this finger out. Okay, and we're going to keep this one down. Okay, and we're still centered at the PIP, left marker. Okay, and then this finger, let go of this one, and this one. Okay, and again. All right, straight out. Okay, now we're going to do digit number 2. So digit number 2, remember we have to flip over. And we're still centering at the PIP. over those fingers, left markers. Okay, any questions on that? All right, so when we do thumb, remember we do an AP thumb. So we turn the hand all the way over, and this time we're centering at the MCP, right? So I can turn my housing to make it look prettier, and so I can get all the way through those metacarpals. So all in clinical, your tube should turn, or your collimator housing should turn. Okay, I don't know if y'all ever seen that yet, but it should turn. So I'm centering at the MCP. Got my left marker, that'll be my AP. All right, and when we do an oblique, that's just the natural position of the hand. Okay, so just lay your hand out there, that's an oblique. Okay, and then when we do the lateral, you're just gonna arch these fingers right here, so do like this. Okay, and that puts the thumb lateral, and we're still centering at the MCP joint, first MCP. Okay, all right, that was all of digits 1 through 5. So hand, we're centering at the third MCP, right? All right, we're gonna spread these fingers apart a little bit. And I wanna get about 1 inch of the wrist. Third MCP. That's PA hand. If you have this lovely wedge, step wedge again, you can do this for oblique hand. We're gonna put each finger on the step. Good. And we're centering at the third MCP again. Oops, cut it off. All right, so I got all the fingers still centering at the third MCP, left marker. Okay, when we do, so if you don't have this wedge, some sites may have you do this, a straight oblique with the 45-degree angle of the hand, and we're still centering at the third MCP. So it depends on the site you're at, okay? I like for you to use the wedge or do this other one that I'm about to do in a minute. Okay, but this one I guess is a little bit more accurate because your fingers are straight and they're parallel to the IR, okay? Or you can do this oblique. Some sites do this, where they have the patient put the fingers on the image receptor and they're still obliqued a little bit. So there, okay? I'll take either one. How about that? Version 1, 2, or 3. This one, or using the wedge. Okay, if you pull a hand. All right, that's oblique. Lateral hand, you're gonna put your hand on your side, please, ma'am. You're gonna make an OK sign. Okay, and you're gonna fan these fingers out. It's a fan lateral, right? Okay, now, when you tell patients to do an OK sign, they may do an OK sign like this, but we don't want to keep their fingers touching, okay? We want to separate. That's just to get us started. And I use my fingers to feel the wrist to make sure she's not too far forward or too far posterior. So I need you to roll back just a little bit. Perfect. Okay, and this time we're centering at the second MCP. Oops, I'm gonna cut your fingers off over there. Second MCP joint. Okay, so remember y'all, when we're looking at digits, we look at it with the digits up. So I have my marker oriented with the part, okay? Not this, right? That's upside down. Not this, okay? All right, that's hand. We did PA, oblique, and lateral. All right, next is wrist. All right, we're gonna bring your arm forward, and I want you to make a fist for me. Good. All right, so this time we're centering right over the wrist joint. Some sites want you to have up until the metacarpals and probably about 2 or 3 inches of the forearm. Okay, so remember, we clench the fist so that we can have less OID. If you unclench, we got a little bit of a gap there. Okay, so we're gonna clench the fist, left marker, center over the carpals. Okay, oblique. We're still centering over the carpals. I shouldn't have to change my light or anything. Lateral, we're gonna shake somebody's hand. We're gonna unclench here, fingers straight out. Some texts may want you to have this thumb up. It's fine as long as it's not interfering in the carpals. Okay, so I always check to make sure she's my patient's not too far anterior or posterior. So I'm gonna roll you back just a little bit. Okay, and remember your radius and ulna should be superimposed here. All right, so that's wrist. Now we're gonna go to forearm. All right, ma'am. So I want you to come right here where Rosalind is. Okay, and you're gonna bring your arm straight out. Okay, slide over just a little bit. It's not rolling well, sorry. All right, we're centering that mid forearm, okay? So we wanna get wrist and elbow. Her elbow is right there, okay? So come forward just a little bit, perfect. So I have elbow joint, I have wrist joint, and my centering criteria is mid shaft. Okay, and we're gonna shoot. All right, ma'am, I'm gonna do one more. Lateral, we're gonna make a turn, bend your elbow. And remember, y'all, we want a 90-degree elbow, okay? So I'm gonna bring you forward just a little bit. And so you may have to put your shoulder down, or you can raise this IR to her. Okay, you want to have everything the same plane. Okay. Remember, you want to get all of the elbow. Elbow joint is here. I want to get about an inch or two of this of the distal humerus, and then all of the wrist joint. Okay, so that's lateral forearm. That's all for forearm, AP and lateral. And we're gonna go to elbow. So you're gonna straighten your elbow out. So bend for me. Make sure, okay, right here. I don't wanna take your shirt up. Okay, we're gonna slide forward, Jacqueline, right there. So with elbow, ladies and Frank, we look at the elbow with the humerus going up. Okay, so I will put my marker like this. Lateral side. Make sure her condyles are what to the IR. Parallel. Scoot forward just a little bit more, I'm sorry. Okay, so you can feel her condyles. So the plane between these two condyles should be here and here, parallel to the IR. Okay, that's my lateral. AP elbow. AP elbow. All right, so we're gonna do an oblique. So we'll do the hard one first, Jacqueline, okay? So you're gonna roll external, about 45 degrees, and scoot your chair that way. Okay, and scoot forward. This way, your arm. I'm sorry, bring your arm. Y'all get the point? You don't break her arm. Okay, 45-degree elbow. Center over the elbow joint, and you should be centered right there. And roll this way. Okay, that's external rotation. So remember, your external rotation does what to these two bones right here? What do they do? Separate. Remember, we're going to exit, so they exit and separate. Okay. All right, medial rotation. We're going to pronate your hand over. Okay, and that creates a 45-degree angle of the elbow. That's all we need to do for that. And this picture right here shows us what? Anatomy in profile. Testing y'all as I go. coronoid. Okay, coronoid process in profile. So that's my medial oblique. And then we're going to do lateral elbow, which we just did on the forearm. Okay, scoot forward. All right, and relax the best you can. So here, my condyles are on top of each other like this. So they are perpendicular to the IR. Does that make sense? Mm-hmm. Okay, and we're going to center over the elbow joint. Or kind of over those condyles. All right, and that gives me my 90-degree elbow. So we did AP, external, medial, and lateral. It's best for me to do for y'all recording. This one? Okay. So I'm just making my light 14 by 17. So for humerus, I need to clear the shoulder and I need to clear the elbow. Okay. So I need you to step to your left. All right. I'll bring this down behind you a little bit. So we're getting the top of this light, or this black line, about an inch above her shoulder. Okay, I'm gonna externally rotate her hand, because I want my condyles, to the IR? Parallel to the IR. Okay, so step over one more time towards Frank. Okay, good. So we're centering mid-shaft. Of course, I would shield her. Okay, so this is AP humerus. Now I could oblique her a little bit to get her flatter against here, but for the most part, that's what we need to do. Okay, lateral. I'm gonna internally rotate your arm. You can do this way, mid shaft. You don't have to touch anything. We're already centered. So my condyles here are what? Perpendicular, because they're like this, right? Perpendicular to the IR. So this is my lateral humerus. I can also do this. That's still lateral humerus. Okay, you want to make sure the condyles are perpendicular. So I'm going to oblique you into the machine just a little bit. Turn your body just a little bit this way. Okay, so that gets her a little bit closer. Everybody see that? Okay, so I could do that, or put the back of your hand on your hip, or I can do that. Okay, so this will be AP humerus. Make sure we over the IR, over central area. Okay, or I can do a PA. So I'm gonna turn you around, facing the board, all the way around. Okay, I know I started over there, but just for the sake of this position. Okay, step over towards Frank. Okay, so I can put my hand on my hip, and I still got a PA, right? Step over just a little bit, Jacqueline. Good. I'm gonna oblique you a little bit, making sure my condyles are perpendicular. Still, so I can either do AP lateral, AP in the lateral position in AP or PA. It doesn't matter to me, whichever one you prefer. All right, you can relax. Okay, that's humerus. Humerus only has two also. Okay, we're gonna put your back against the board, and now we're gonna go to shoulder. Rotate my 12. Okay. So I'm gonna raise this up, okay? So, ladies and gentle sir, we want to get from jugular notch all the way out here. We want to get jugular notch acromial end of the shoulder, okay? So we're going to step over to Frank. Okay, good. Come back to the side. Okay, good. All right, so for shoulder, we're doing 3 projections. We're going to do, I should be axillary while she's down there. Why are you reminding me, Mika? All right, so for shoulder, we're doing neutral, just like her hand is now. That makes a 45-degree elbow. All right, and it kind of puts the greater tubercle and lesser tubercle kind of side by side up here. So 45-degree oblique. I got jugular notch all the way out here because I want a acromion and sternal in, and I want the bottom of her scapular in there too. Okay, I gotta get the inferior margin. Okay. Some orthopedic sites will have you get from here over because they're only concerned about the joint. But in a true shoulder girdle, I want the clavicle included. Okay. So this is neutral, and then I'm going to tell my patient to turn your hand outward, and this will be my external rotation. You see, I didn't even move her. External rotation, condyles are parallel to the IR. This puts my greater tubercle in profile laterally. Then internal rotation, turn your hand in. My condyles are perpendicular to the IR, and this puts my greater tubercle in, my lesser tubercle in profile medially. Okay, external is for greater tubercle, internal is for the lesser tubercle. All right. And in the book, it tells you the center, what is it, 1 inch below the coral cord. So what I did is just put an inch of light above her shoulder, or I can feel her clavicle and go about an inch below that. Don't make it hard. In clinical, they're gonna do this, just frame it. That's what it's called, okay? If you do about an inch above the shoulder, you're good to go. All right, so that's routine shoulder. We're gonna do axillary to go with it, but I'll do it at the end because I have to flip this back down. Okay, what else I got to do? What else we have to do, y'all? Scapular lock, okay? Some sites, some techs will do scapular AP, some doing PA. Have y'all seen them? AP, mostly.
They say you barely see scapula.
You can barely see it?
No, they say that you can barely, the doctors barely order scapula.
Oh yeah.
They order shoulder and
Yeah,
scapula.
they're not gonna order, they typically don't order a scapula by itself. They'll order a shoulder. Yeah. Okay, so I turned the IR, the field size lengthwise, y'all, because it's gonna be like a Y, remember? I try to orient my field size to the anatomy. So if I'm in a Y, that's more long than wide. Does that make sense? Okay. So you can, some techs will have the patient grab on their shoulder, or they'll have them just put their hand across. Doesn't matter to me, whichever one works for you. The whole point is though, the scapula needs to be perpendicular to this IR. Okay. So I can see her scapula. So I'm gonna rotate her so that it is perpendicular to this IR. Okay? So the tips I left for you in Blackboard, the patient, the lady was holding like the top of the scapula and inferior angle, superior angle, and then she put the crosshair through here. I'm not good with tips, I just feel for the scapula, okay? So the border of her scapula is right there. So I'm gonna rotate you a little bit more so that it is perpendicular to this IR. And I'm gonna shoot, okay? Scapular Y is one of them things you have to do trial and error. You might get it first try, you might have to do it again, okay? You gotta look at the border of the scapula to see which way the patient is rotating when you take your image, okay? I like to do mine's PA so I can see the scapula. Okay, so I'm gonna turn you all the way around. Alright, I'm just gonna do this one for the sake of doing it, okay? So the medial border of her scapula is there. Okay? So I'm gonna rotate Jacqueline until the scapula is perpendicular. I can feel her scapula right there. Okay? And then I'm gonna shoot in the middle of her scapula. Mid-scapula. Like that round marker up there. Does that make sense, everybody? Okay. And so if your patient is unsteady, with this hand, she can hold on to the corner of the IR just to keep her in place. I've done that before, okay? So, I like to do them PA, but you can do either way. So sometimes you can have the patient like put their hand back here, and you can feel the border of the scapula really, really well. And then you can still rotate them so that you can feel the border of the scapula. Has anybody done a scapula? Done it, Mika?
I haven't done anything.
We know you have. All right. So that's scapular Y. I'm gonna put your back against here again, and we're gonna do clavicle. Oh, let me do transthoracic. Okay, we're gonna turn sideways. So with transthoracic, the point is to get the surgical neck closest to the IR. Okay, so y'all remember the surgical neck is about right here. Okay, up here is anatomic neck. Okay, surgical neck is about right here. So I'm just kind of eyeballing it, using this arm, bless you. Okay, and I'm kind of eyeballing it over here. So I want the surgical neck of this affected arm in that box. Okay, so she's not going to move that arm, right? Because that's the hurt arm. And I want to make sure she's lateral. And I want you to raise this arm up above your head, ma'am. All right. And you can relax it on top of your head, or if you okay with it straight up, that's fine. All right. And I'm going to kind of collimate to the surgical, to the shoulder. I don't need all her neck in there. I just need the surgical neck of this humerus. Put my left marker here, and I'm going to shoot. That's transthoracic. Pretty simple. Now, you can do transthoracic for the proximal head of the humerus, and you can do it for the entire humerus. Those are two different projections in your book. But for me, we're just doing the proximal humeral head, okay? All right. You can put your back against the board again for me. And we're going to do clavicle. So her clavicle is right there. I want the central ray to go through the clavicle. All right, step over to Frank a little bit. Right there. I want to get surgical sternal end and acromial end. Okay. You can keep your arm neutral. I think in that video, one of the ladies said turn it external, but it doesn't matter. Okay, jugular notch or sternal end, acromial end, centering on the clavicle. That's my AP. All right, then we're gonna do AP axial. So we're gonna angle how much? Y'all remember? It's about 15 to 20. So 90 plus, typically text just put a 20-degree angle on it. So 90 plus 20 is what, 110? Okay. All right, I'm gonna bring this down, Jack. Sorry, up. And we're centering through the clavicle again. Legs. Okay, you can either hold your breath, or I think it says take in a deep breath and hold it, and that'll help with the patient's clavicle going above the apices. Okay, through the clavicle, acromial end, sternal end, right marker, shield, 20-degree angle. And that's all to it. Okay? So we did everything except axillary, right? Okay. Last for axillary. Yeah.
They make them at the VA. They make them suffer at the VA.
They make you suffer and get them in the middle.
Yes.
God bless the patients. You're right though. They don't care. It's like any means necessary. We're gonna get it in here. Okay, we're gonna turn sideways towards Frank. Okay, and you're gonna extend your arm. Let's see if we can bring this up. Oh, let's see it. We're gonna see it. be like this. They're gonna be what, 80 years old, right? You're trying to get an axillary. All right, we're gonna get your head out of the picture. So her joint space is right there. Scoot forward just a little bit. You seen it, Alexis? You have? And so we want the central ray to go over the joint space. Okay? So Jacqueline is a pretty good patient. If your patient don't have the lean in them like she does, right? We can throw a little angle on there. Like what, 5 to 8, something like that. And then I'm going to center over the joint. That's gonna help throw it this way, if that makes sense. Okay, so this is my axillary, superior, inferior projection. Okay, so you gotta make sure their head is out of the picture, the hair and all that, and make sure they're pretty flexible. And we're gonna center over that joint space. You can feel it. Y'all wanna feel it? Not really? Nope.
I know this wouldn't be for checkups, but
Okay, relax.
I've seen them do it with the cassette, like on the table, like have them sit on the table. Donna has them do it, and sometimes it's easier.
Like